Let's talk about disc issues. Hey guys, it's Dr. Watt from Pinecrest Chiropractic. Disc issues are a thing that are super common. Let's talk about why though. Well, first off, what are your discs? Your discs are these kind of spacers or shock absorbers or things that lie in between the vertebrae here. We like to refer to them as spacers because they're made to create space in between these vertebrae and then help with movement, right? That space there is going to allow for a more free range of motion. Some people call them shock absorbers, and although that's kind of true, I don't think that's the best way to explain it. But these things are responsible for transmitting force between every single vertebra up and down your entire spine. You have them in your neck, you have them in your middle back, and yes, you have them in your low back. That's where most of us are most familiar with them, because that's where we see the most disc injuries. Now, they happen other places as well. When we talk about these disc injuries, the disc here is made up of two separate pieces. Now, the inner part is called a nucleus propulsus. The outer part is the annular fibrosus. The nucleus is this jelly-like fluid type substance. They've actually found that the consistency of it though changes with injury, so I don't want to put too much of a descriptor on that. But then we talk about the annular fibrosus. That's the fibrinous part. That's the really hard, firm part that's made to hold the nucleus on the inside. And so when we have an injury to our disc, it almost always starts with the annular fibrosus. And oftentimes those injuries are small, just a little tweak or a pull, and you're slowly damaging the layers of that annular fibrosus. And eventually that can start to damage to the point that that nucleus starts to put pressure back out the back of the spine. Almost all of these disc herniations and bulges are on the posterior part of the spine, affecting affecting the spinal cord and then the nerves that come out in between the vertebrae. Now, we talked about how these things are super common. Why in the world are they so common? Well, our discs actually start to degenerate at around the age 18 to 20-ish, right? And they start to degenerate because that's when the blood supply to the disc is starting to be cut off. That blood supply is crucial for healing and functioning and growing up to that point. But at that point, you're usually full grown and done growing, and so the disc doesn't have any more blood supply. With no blood supply means increased injury healing time. We look at things like ligaments and discs, which both have poor blood supply, take much longer to heal because of that. And so that's why disc injuries are so common. The other big reason is these joints are very mobile. When we have mobile joints, we have to trade off stability. So these things aren't always as stable as we'd like them to be, meaning other muscles and joints around have to be more stable to stabilize this. And so in a lifestyle where we spend much of our time sitting, we see a lot more pressure on discs, less core activation, and are therefore putting more pressure on your disc. And in fact, when we bring up sitting is tenfold more pressure on your disc than you are standing. When you stand, there's only about 10 pounds per square inch of pressure on a disc. Laying down, there's about 1. But when we stand up, it's about 100 pounds of pressure per square inch. That's a lot of pressure on our low back just from sitting down. And so there's lots of things that pull into the reason that these disc injuries are so common. What do they feel like? Well, oftentimes they are just a pain in the low back. But we can even see neurologic involvement, as if we already talked about, that disc can put pressure on the nerve and create either pain here or pain that refers elsewhere. We also see muscle spasms. Those muscle spasms often happen when there's an injury here and your body goes, hey, I need to protect that. I want to keep it safe. So it spasms to try and stabilize it so it can't move. Now that does limit the healing process, but in the short term, that keeps you from aggravating it even more. And so all of these different things can happen. One of the easy ways for you to treat it at home is start to find a directional preference, is the fancy words for it. In other words, find a movement that you can do that's going to help push that disc back into the core of it, back into the nucleus. And that'll get pressure off the nerve, keep from aggravating your pain again and again and again. And so that's something you can do at home, as well as things like nerve flossing are both great tools that we talk about in other videos. But what is the best thing to do for a long-term changes within that? And how do we treat and diagnose these things? Well, when we start off with a disc injury patient, we start off like we do every other patient. We do a thorough consult to figure out how it started, why it started, when it started. We then move into orthopedic examinations and all of our different neuro exams as well to figure out, okay, if this is a nerve injury or this is a disc injury affecting one of the nerves, what level is it coming from? Is it coming from L4-5? Is it coming from L5-S1? And that can then affect how we treat it as well. We can even then pull in things like x-rays if we need to. X-rays are great for more of the degenerative changes, to see the space in between the disc, not looking at the disc themselves, because you can't see discs on x-rays, just the space. So once we gather all of this information, we pull that together in and figure out how do we treat this case specifically. And we start off with adjustments. Adjustments are going to be our bread and butter for making changes within that. It's going to restore proper movement to these joints. It can even start to open that disc back up again, so that it creates a negative pressure trying to suck some of the disc back in. We'll then supplement with other modalities as well, things like stabilization exercises and rehabilitation exercises. Those things are crucial for restabilizing the rest of the core, like we talked about earlier, to keep that disc safe in the future. We also then can do things like laser works really, really well. Laser works on increasing blood flow and circulation. Discs have poor blood supply, like we talked about already. So as we use laser, that's going to drive more blood supply into the disc itself and get that to start to heal. Works great. We also can use shockwave therapy. That's going to break down those tight hypertonic muscles, those muscles that spasmed up and we can't get to let go now. We use shockwave to start to strip those muscles down and actually get range of motion back through those joints. So we've got lots of different tools depending on what case is sitting in front of us there. And so if you want to know more about your disc and your disc injury and maybe what caused it and how we get out of that, come on in. Let's chat about it.